Hello and welcome to today's session. Today we're going to look at ways to reduce anxiety. Anxiety is such a common human experience and affects all of us at any given time. But for some of us, it becomes quite entrenched, quite low grade, quite prevalent, and quite persistent. And for that reason, I've thought today would be a very good kind of frame to kind of look at ways to reduce anxiety, but so too, also look at some of the underlying mechanics that can either increase or aggravate anxiety or further decrease anxiety. So let's kick it off. Today, we're going to figure out the things we can do to reduce our anxiety. And what's important to note is that anxiety is a really important psychological and physiological response. It is a very important indicator within us that tells us there's an action we need to do or there's something we need to take care of. And of course, when it becomes too maladapted or when it becomes too entrenched, then it can cause all sorts of physiological distresses as well as emotional and psychological distresses. So in trying to reduce anxiety, and that's what we want to try and talk about today, we also have to look at the ingredients that make up anxiety and what increases it, and so too what can reduce it. So let's kick off. First of all, anxiety is normal. It's a normal psychological phenomenon. It's a normal psychological response. And the reason it exists is, in some ways, it is a red light that flashes that tells us there's something we need to do, express, or choose in some way. So it's an emotional and physiological response, anxiety. It's not just a mental response to uncertainty about a possible threat or danger that provokes a distinct cognitive, a thought, as well as an emotional set of responses and behaviors. And the reason for this is the mind is trying to push us to maybe do something about this threat that we've just seen. This is the most basic understanding of anxiety. But it becomes a bit more complicated than that because maybe 1,000 years ago we had different kinds of threats than we do today. Even 100 years ago we had different things that would cause us anxiety to today. So let's look a bit more at what that actually looks like. So if we can see here that anxiety is an alarm, and basically it's telling you that there's something you need to do, something you need to act on, something you need to express, which is very useful, when there's a fire. Or 150 years ago, a lion jumped into the room. But of course, we have different things now that feel like threats, different interactions, different forecasting and kind of future casting where we think about the future, and that can also cause us anxiety. So it doesn't really work so well as an alarm if the things aren't clear and present in terms of their danger. So now we know in psychology, and this is a lot of esteemed scholars' work over a very long period of time, going back to the earliest psychologists and even philosophers, that anxiety has three main types. And the first one, unsurprisingly, is fairly straightforward. The first one is objective anxiety. And that is, there's a bear in the room. And remember what anxiety's purpose is? It's to tell you to do something. So a bear comes into the room, wild bear, I might add, not a tame bear. Bear comes into the room and I get anxious, and this is my alarm. This is my alarm call to take action, to do something. And then we see three different types of responses: fight, flight, or freeze. And there is another one in codependent structures or in mesh structures where we see a kind of a fawning or trying to kind of please. But we're not going to get into that today. I want to just tell you how you can reduce your anxiety. And to do that, I need you to understand or look at where your anxiety is coming from, or get a sense at least of where the anxiety is coming from. So the first one is what we call objective or real. It's in the here and now. It's right now. There's a fire. There's an alarm going off. There's a bear in the room. It's real objective anxiety. And this one we act on almost instantaneously. The second one is one that kind of covers more of the human experience. And this is referred to as existential anxiety. I'm not going to get into too much of this today, but this is basically about being human. Why am I here? What is my purpose? How do we get here? What is the purpose of the universe? And if you do feel like you're struggling with a lot of those questions, it may be a very good time for you to look to go for counseling or psychotherapy or psychoanalysis. You may be at that point where you're primed to really want to start, talking to someone about those issues that are causing you this kind of anxiety or these thoughts that come up. And the last one is the one that affects all of us in the most devastating way. And this one we refer to as neurotic anxiety. And the reason why it is so incredibly persistent is because there is a sense that the thing that is happening, or the thought that we are having, or the feeling that we're having, is about in some ways getting into trouble or being punished, or something bad's going to happen to us. Now, in the first example, that's true, because a bear's walked into the room. In the second example, well, it's more existential. It's much more longer term and something for a lot more kind of talk therapy. But this last one has to do with our response to the world, and it's in some ways our response to the world kind of gets curtailed. So there might be a conversation I need to have in the future, or there might be something I need to do in 2 weeks' time, and I'm thinking about it a lot, and I'm worried about being in trouble or something going wrong about it, and that starts stirring up what we refer to as neurotic anxiety. It hasn't happened yet, it isn't actually in fact real, it isn't in front of you, but still the anxiety is there, and this is why it's referred to as neurotic. It's not saying that you are neurotic, it is saying that that is the type of anxiety. It is generally future-based. It's generally not in the here and now. Sometimes it is. I mean, if I'm having a difficult conversation with someone and I need to say something like, I need to let you know that what you said made me angry. But if we're worried or I fear being punished for saying that because I'm enmeshed in the relationship, I will then start building this neurotic anxiety, the energy within. So those are the three types. And neurotic anxiety is very prolific and it tends to stick around. And the actual reason for the neurotic anxiety isn't always clear. We're sitting there and we're kind of fiddling around the house and we're procrastinating, and this sense of dread or anxiety is building and we can't quite figure it out. It requires quite a lot of thought, and sometimes talk therapy and counseling is the best way to do it, is to find out actually the source of this is, maybe your in-laws are coming in 2 weeks' time, and that's not really present on your radar, but it is to your unconscious. Or maybe your partner's coming home and the relationship isn't going well, and that's always been a source of anxiety for you, but now it's neurotic, And there's a lot of thinking around neurotic anxiety because often it is not in the moment and real. So often what we try and do is we try and understand the source of the anxiety. Is it objective? Is it existential? Or is it neurotic? And if it's neurotic, is it future-based, and is the event real? And what are your thoughts and feelings around that future event? So this goes a long way to reducing it, if you can nail down which one of the three it is. And if it's neurotic anxiety, I want you to give yourselves a break and be gentle with yourselves, because this is the kind of anxiety I don't think we had a huge amount of 1,000 years ago. We have so many deadlines and calendars and phone calls and WhatsApps, and the feeling when the WhatsApp dings on your phone or whatever messenger it might be, and then there's a sense of anxiety. Nothing has happened yet. Nothing has happened yet. It's in the future, your fear. It's about what the message might mean, or who is sending me the message, or what could it possibly entail. And so give yourself a break. Neurotic anxiety is extremely common. It is very much, I think, one of the side effects of living in a modern society that's always connected. And so when you think about your neurotic anxiety, just slow down and breathe, and let's not cause extra objective or in the moment real anxiety around it. So what can we do? That's really how this presentation kind of began. The first thing to know is what drives the anxiety up, apart from objective, existential, or neurotic. So future-based thinking, worried about a response that I might be in trouble. That I might be rejected, or something might go wrong, or might be abandoned or rejected. These are all the kind of things that feed neurotic anxiety. The first thing that increases it, which you can tell because the anxiety tells you need to do something, and if you don't do something, then the anxiety builds. So we know that the anxiety will be pushed up if we don't say anything, if we take no action, if we don't act, if we don't express ourselves, if we don't say how we're feeling. This will drive it up. So self-imposed limitations on expression of your emotions in the moment when you're feeling a certain way, and things that you need, you put your needs to the side and you just keep on holding on to them. This is one of the greatest drivers of neurotic anxiety. One of the greatest drivers, if one can start a process of expression and trying to be more authentic. What I'm feeling on the inside about this, I want to express on the outside. If I can start doing that, and of course we need to feel safe, and we need a sense of alliance with whoever we're speaking to around it. But if we can do that, then we certainly do reduce the anxiety tremendously. And in fact, one might actually eradicate it completely. The other thing that drives up anxiety is if you have a lack of social or skills or support. And this is very important because if there are tasks to be done in the future, I might have neurotic anxiety around it. But if I don't have any skills for that task, or I haven't been able to express myself to say, or I haven't felt safe around people to say, actually, I can't manage with this. I know you want me to be a superhuman, but it's actually killing me. This is the kind of thing that will drive it up because I don't have that kind of connection, that maybe even the skill or the support. And I think that a lot of the time students will have a lot of their anxiety, neurotic anxiety, is driven up by this, and eventually they start procrastinating instead of actually not self-inhibiting, going to a person and saying, I need help, I need skills, I need support. So that drives it up tremendously. But anxiety is not just psychological. Well, it is, but it's not just in terms of the mind operating abstractly. There's also very much a physiology behind anxiety. The sympathetic system is involved in trying to prime us to kind of beat these things off in objective anxiety, but in a neurotic anxiety it gets primed anyway. So we when we get anxious, we get the heart rate up, maybe our skin gets clammy, maybe there's tension in our body. It's trying to prepare us for some objective anxiety solutions. But of course it's not a here and now problem. It's probably a test that you're taking in 2 weeks' time, yet the physiology always follows. So we see that if we don't have or if we have a lack of adequate sleep, or if there's unusual sleep, shift work, staying up really late, not being in your circadian rhythm, less than 7 hours or many more than 10, these things, absolutely, you're on the back foot immediately. You're starting the new day in a hotbed of anxiety. Stimulants, because it's a physiological response, anxiety, stimulants will actually drive it up. At some point, they might make us feel calm because the level of anxiety that we reach is somehow matched by the stimulant. So in some way, there's a stasis. But in fact, when the cigarette's effects drop off, we see this big gap in the physiology, and then the brain really kind of reacts quite poorly. And now you got objective anxiety physiologically from the cigarette withdrawal, and you also still have the neurotic anxiety about the thing happening in the future. So caffeine, nicotine, and stimulants. And of course, caffeine is heavily implicated in preventing sleep. I know not for everyone, but there's some good studies. So these affect the sympathetic system and increase physiological stress. And when you're already worried about a test 2 weeks in the future, or what my partner's going to say when they come back from holiday, the last thing you need is your body being extra stressed, and this drives it up completely. And the last one is psychotropics, neuroleptics, alcohol, and depressants. And the reason I say this is because the body adapts to things we put inside it. And if you have a hangover, for example, that kind of depression one feels is very systemic. It's from the fact that the body is trying to recover, but we feel it characterologically, we feel it mentally, so we can't tell the difference. That can drive up our anxiety. Of course, if we struggle with alcohol or substance use disorders, this will massively drive up our anxiety. So this is a kind of an artificial driver of anxiety, but a very real one. When I say artificial, is that if you can remove this, you have a much better chance. That's why inpatient programs for treatment centers work really well, because a lot of this is removed, and a little bit of this. And then the physiological part of the anxiety, the stress on the body, is massively reduced so that the anxiety itself can be looked at and treated. And so these are the drivers: self-inhibition, lack of social support and skills, lack of adequate sleep or shift work or sleep that is interrupted, caffeine, stimulants, nicotine, and then psychotropics. You put something into your body to try to help you sleep, and it works for a while, but in fact the body adapts. So I'm not a doctor, so I want to be very clear on this, that one needs to look at when it comes to these bottom three, and you are looking at your anxiety or stress levels, please consult a doctor and find out, if maybe some of these areas are areas that you could look at to help you. But for sure, they will drive up anxiety like no one's business. But we're here today to talk about how you can drive it down. So let's do that. The first is to allow yourself to either express or take action around one of the drivers. So if there's a test next week that is causing you low-grade anxiety, go to someone and just say something. Just express something. Remember that the anxiety is an alarm. The alarm is flashing on the dashboard and saying, this engine is in trouble. Go to someone and say, hey, this engine is in trouble. Hey, I've got this exam I'm really worried about. This top reason is why therapy usually feels quite good. Even though in therapy you may not feel like you've moved around a certain kind of element of your life enough, but often one will feel better even after 50 minutes of talking. And the reason is that that alarm goes off when you start expressing, when you start taking action. This is easier said than done, of course, because there can be many things that get in the way from you being able to take action, have difficult conversations, talk about things. You may have struggled being vulnerable. You may struggle with resilience. There may be issues around enmeshment in families. You may feel like you have an ascribed role, like I'm the strong one. I need to always pitch up and just be okay. So this, and we know this is the best way to get anxiety, to get that flashing light off and to reduce anxiety. So expressing yourself or taking action around. And it doesn't have to be exactly on the exam, because you're not writing the exam, remember, that's 2 weeks away. It's about talking about it with someone. Which leads to connection and support, which you kind of need for the first one. If we feel connected to others, we can share with them, as well as lean in for strength if we are low in our own strength. So we're reaching out for strength, and we're connecting, we're bridging, and this reduces our anxiety because we don't feel like we carry it all on our own. We also get perspective. If I have connectivity, if I have people I can check in with, I tend to have perspective, and the noise in my head can sometimes reduce, particularly the future-based neurotic anxiety. And connection and support, of course, goes hand in hand with taking action and expressing. And then circadian rest, to make sure one is resting within one's resting cycle and enough of it, will, and if it's non-tranquilized, of course, that's fine if one needs to medicate oneself for sleep and doctors have prescribed it, but the brain needs to do a lot of kind of work while you're sleeping. There's lymphatic drainage, all those chemical reactions from the day's thinking and emotional feelings. All of those things have to be swept away and the brain has to be renewed for the next day. There's physiological aspects, blood pressure aspects, which talk about the physiology of stress and anxiety, not just the mental part. So getting adequate rest puts one on the best foot. I've seen with many clients, just getting good rest, even if the anxiety persists about something future-based, just getting rest enables them to have a less of a physiological response to the stress, and in some ways reduces the neurotic element of the stress as well. So just getting good rest goes a long way. It's the age-old rules: drink water, get rest, move. Caffeine and nicotine stimulants, if you can remove these from your diet, and of course, if you're going to do any of these things, whether you are taking them or you are thinking of reducing them, please do it with a doctor at your side. That's someone that you've spoken to. But for sure, reducing stimulants reduces the physiological impact of stress. Remember, you don't want to have neurotic anxiety and then elevate your physiology. And then the physiology is then, even if you stop thinking about the neurotic anxiety for a while, you're still going to have that physiological response where my chest still feels tight. I don't know what's going on. So you want to make sure you look at all the physiological aspects of anxiety as well. All those responses that have come from the neurotic thoughts, they also need to be in some ways looked at and taken down. And of course, move more. I would have added here hydrate as well, but I don't know if that helps with anxiety. It's probably just very good for you. But if we move more, we actually, and specifically resistance training, light cardio. Again, I'm not a doctor or a kinesiologist, so the thing is that we know that the body needs to form a certain type of physiological resilience. If I'm sedentary and I'm not moving around, I'm not building a resilience to the physiological part of the anxiety and the stress. And so we know that if the body can become slightly more tuned and able to deal with physiology anxiety, then it doesn't impact the mind. It doesn't aggravate and get much, much worse. So this is the way to reduce anxiety. Express, take action, whoever that might be. It might be a therapist, it might be a friend. If you're religious, it might be someone in the church. Connect, get social support, speak to people and build bridges. Say, hey, can I ask you, next time I'm feeling a bit kind of unsure about myself, can I reach out to you? Find like-minded people. If your anxiety comes from PTSD or comes from surviving, childhood trauma of some kind, find support groups. The connection and support is also very important because that's going to allow you to start expressing yourself. And once you express yourself, we know this is the greatest way to remove it. Get adequate rest. Reduce the amount of stimulants in terms of nicotine and caffeine. And it goes without saying that any narcotics is an extremely bad idea. It would immediately raise anxiety. And try and move more. Honor yourself with moving more. And those are the ways that you can reduce your stress. I hope it's been helpful. All I have left to say is that you are beautiful, you are worthy, you are enough. and please be gentle with yourself and others until I see you next time.